I'm Di. I work for Parliament of Victoria, here in Peter Crisp's office, member for Mildura. Every day is different, every person is different, from someone ringing to ask for a phone number to someone who's in so much financial, emotional stress. Quite often the staff will have someone call or come in to, say, the front counter, and they are making statements that concern me that they may be going to harm themselves, and I've never known the correct procedure or how to help.
My name's Meryl White. I work for Murray Primary Health Network and I'm the coordinator of the Mildura suicide prevention trial. One of the interesting pieces of work that we have done so far was organising some suicide prevention training and support in the offices of our parliamentarians. Particularly the staff in the state members' office felt that they were often the end of a chain. When people had been everywhere else, they'd walk through their doors. So we were able to source some particular training specifically for those two groups.
Not only did they walk me through what I would need to do, but I now have contacts that I can advise someone who may be experiencing some difficulties to go to, and I can ring them as well to seek information and help.
No worries. Bye.
I'm Ash Falvo. I'm a journalist with the Sunridge Daily newspaper here in Mildura. Being a smaller regional newsroom, our responsibility falls in the fact that the people that we report on and the suicides that we report on have happened here in our community. So we need to be really mindful that family and friends will read this.
The way that suicide is portrayed in media can have an impact on subsequent deaths and attempts in a community. So we went out to our local ABC radio station and a couple of our local newspapers just to raise awareness through this trial around the Mindframe guidelines for particularly journalists in safely and responsibly talking about suicide.
We all had quite an open discussion about it and sort of said, yeah, I'm scared to write about it. I want to be able to do it well. And I think her delivering that training gave us the confidence to know that we could do it and we could do it with the respect and dignity that it deserves.
Without a doubt, place-based suicide prevention is about saving lives, but it's also about thinking about the people who are left behind, and that's where we've had a lot of support from community, particularly the community of Merbeen early on in the trial.
Our town had been through, bereavement of suicide. I approached the Mildura trial. Standby Murray came and did a what do I say, what do I do session. And 65 people of the community turned up. So to me that indicated that, yeah, it was needed and it was well accepted.
So when we started the trial in Mildura here in August last year, we started a process of conversation and consultation. Because it's being driven by community need and an identified need, we haven't had any trouble in getting people involved.
I'm very excited about it being successful outcomes for everybody here in Mildura and our little town of Merbeen as well.